All right, it's 11:02. We're getting started here just shortly. We've got, look at that, 40 participants on already at 11:02. All right, we'll get started here in just another minute. All right, we've got 48 folks on. It is 11:03. Good morning. This is Coffee with Community Services. My name is John Decker, the Director of Community Services at Alta California Regional Center. And as we have shared with folks, we record these meetings now, and recordings are available on our website. We've got a number of different Alta staff on today, and as usual, we will introduce our staff, and I'll do my very best to make sure I catch them all. I see one of our residential managers, actually a couple of our residential managers. I see Christina this morning. Good morning, Christina Lane. And I see Rowena as well. Good morning, Rowena. And then Carol is here from our SLS department and Deaf Services. And I see Camellia, our clinical director. Good morning, Camellia. And Jean, one of our community services managers. And Shirley, who, as I say every time, is responsible for quite a few of your vendorizations and community services. Hewitt, our emergency coordinators, with us again today as usual, and we've got Jason with us. Good morning, Jason. Jordan, another one of our community services managers that's oversees our specialized services and supports unit, and we've got Heather Hollingworth, again, another one of our community services specialists. I see Heidi there. Good morning, Heidi, up in Grass Valley. She's got her little half gloves on that I was wearing this morning in the my home office RV because it was oh so cold this morning. We have Olivia, another one of our community services managers. Kate, hello, Kate, as well. And we have my assistant, Zach. Hey, Zach. Zach, I'm wearing not your sweatshirt, but my sweatshirt that I ordered. Yours is going to be sitting there waiting for you back at the office when you come in. And then we have Ms. Lori Benalis as well. Good morning, Lori, our director at Alta California Regional Center. So very nice to have our executive director here with us today as well. And again, we've got a pretty large group of folks. Hey, Dana. Dana typically is one of our client services managers that always attends these meetings. Good to see you as well. For Alta staff, this is also gives folks a good opportunity to hear about what's going on and also hear directly from you as service providers related to kind of things that you're facing as well. Today, we've got a number of things that we're going to be talking about. We're going to be discussing, again, an update on where we're at with COVID numbers. We're going to share some information about PPE and what our plans are for PPE distribution. We're going to discuss the transportation vendor forum that we had. There was an extension of directives that went out, waivers and directives related to COVID-19 that just went out. Going to share about that as well. And then we're going to talk about two other things. One is the staffing contract that we're looking at doing with Columbus, talk a little bit about that. And then we will also discuss an idea that we were talking about amongst the community services managers. And so Gino Nessi is going to talk with you about service provider satisfaction surveys. So we'll get to that too. All right. So first off, in talking about the COVID numbers, as you are seeing, statewide, nationwide right now, we are dealing with a decline in numbers there. Obviously, very encouraging as we see that. We know that the Omicron surge, though we saw a huge number of individuals that contracted COVID with the Omicron surge, the hospitalization numbers were much lower than what we dealt with during the huge surge that we had over the summer and definitely last winter. So though we're having more individuals that are testing positive, I think for a combination of both the number of folks that have the vaccinations as well as the number of individuals that are being treated with better therapeutic drugs once they contract the COVID, we're seeing again less and less impact, even though the cases are still really high. That being said, we know that the mask mandate was lifted in a lot of different sectors recently as well. And I will say I certainly noticed it because there's a lot more increased traffic on the roads. I think more and more people are starting to go back into the office right now. So with that said, we're really pleased about that, but we also recognize that there's still in many different settings the requirement for the mask mandates. And so at Alta, we have heard loud and clear from our service providers that you still wanted us to provide opportunities to get PPE. And so with that, we went out to Sonoma Developmental Center and got a pallet of N95 masks and drove them back to Alta and are looking at beginning distribution of those. I think we're going to be looking at one weekly distribution a month. I think we'll be looking at Mondays and Thursdays. We're going to be sending out a notice to you all this week, excuse me, next week. And we're going to be changing the response to the PPE inbox that we've set up. Right now, it's set up to give you an automatic response. For many of you, it's directing you as licensed programs to get in touch with your licensing program analysts. What we have learned recently is that your licensing program analysts do not have masks to give you. We were told initially that they did. We've now learned that community care licensing does not have those. And so for those licensed facilities, and again, we have both Christina and Rowena who have many of our licensed homes, but we also have other residential managers like Heidi on here as well. So for those licensed homes, we really want you to be reaching out to your facility liaisons. You're supposed to have that really close connection with your facility liaisons. Those facility liaisons can arrange pickups for you of PPE. We will make sure that there's enough N95s, enough surgical masks that the managers all have access to. Again, supported living agencies, we know that you constantly have a need for these things as well. That might be a little bit easier to get addressed through our PPE inbox. But for those residential facilities, you know, we know, and I will say Heather Hollingworth has been one of our very responsive community services specialists when it comes to trying to make the PPE available. And so we just don't want congregate settings to have to wait until the next Thursday comes around or the next Monday. And with the amount of staff and managers that we have in the office for congregate settings, we just want to be more responsive. So we'll work on a contact with the facility liaisons specifically for those licensed residential facilities, whether you're a day program, you're looking for them, or other ones. Let's look at sending it into the PPE inbox. And again, this is going to go out via a message to all of our providers next week with complete instructions on what we're going to do. And as I mentioned, Jordan will have our inbox updated so that there is a new message that's created. So we're looking at Mondays and Thursdays doing this. We're going to be switching off. And so again, we'll put the calendar out. I know we have case management supervisors and community services managers that are going to be looking at helping out with the PPE distributions. And so just again, stay tuned. We'll put the information out there for everyone. As it relates to some of the other PPE items, we do have a limited amount of other PPE items available. And so, you know, again, facility liaisons, we will primarily be looking at providing some of those other materials to the residential settings and making some of those other things available. And we will certainly make sure that if we get low in Grass Valley, for example, Roseville, any of our outlying offices, that we get additional supplies out there now that we know that there's not a resource available through community care licensing. Are there any questions about that? I'll go over to the chat and just see if there's anything in there. No, the chat is nice and empty so far. We haven't gotten into anything controversial at all today, so that's good. We'll wait a little bit to see where that goes. All right, we had a transportation vendor forum. Gene, anything that we want to look at highlighting out of the transportation vendor forum? I think, if anything, one of the things that was touched on was the fact that your rate methodology will not be changing in the month of April. I hope that all of the supported living providers had an opportunity to sit in on the meeting. Gosh, I think it was like last Monday that DDS, it was on Valentine's Day. Valentine's Day with DDS. Yes, that's what it was. Valentine's Day with DDS was to go over the supported living agencies and help explain the rate study. So where there might be these rate models and these rate numbers that Burns and Associates have figured out for our regional centers, they still need to figure out how we have individually vendorized some of our vendors in order for them to be able to be given those amounts, if that makes sense. And what that means in the world of like Olivia and Jean and Jordan being the managers, and with Iqbal, our CFO, and Robin, his purchase of service manager, is really looking at, in some cases, pulling apart some of the activities that occur under a rate that has more than just direct service built into it, which some of our rates have. And so, in order to be as fair as possible to service providers, we have to figure out what those combined rates really consist of. And that is what the outreach has been by Olivia's staff, by Jean's staff. I think that's the best way to explain it, is helping us ensure that you're getting a fair shake when it comes to, this is how we believe that your rate was created. This is how we need to break your rate apart so that we can take you to that percentage increase that will get to you to where the new rate study numbers are. There was a lot of concerns, and by the way, we have now, I guess, we're transitioning to the rate study stuff just in general, because that seemed to be the biggest topic of conversation as it related to the transportation providers and the supported living providers was, rate study implementation and how quickly are things going to change. So again, we're not looking at the way people bill changing right now. However, we are looking at how to fairly implement the rate study across vendors that have multiple different ways in which we have figured out how to pay them under the same service code. And again, a lot of the creativity that regional centers have done over the years is to come in and be able to provide services under the median rates. And the median rate structure has made it challenging, and it's made us all be very creative at regional centers, but it also means that it's going to take some math and some separating some things out to figure out how to implement the rate increases. So I'm going to, as I usually do, go over to DDS's website and share with folks some information on where they can find things. I try not to rely on emails when it comes to information to you all, though we all love getting Marty Emoto's emails, and it really helps us be very clear about all the things that are going on in our system. DDS also does a great job with their email notifications, but there's just so much in our emails. So we always want you as providers to be able to go onto DDS's website and be able to look very quickly and have an idea of what are the things that DDS is prioritizing and what do they feel are highlights that we should know about. And I will also say good morning to Odelia, another one of our community services specialists. Hey, Odelia. All right, so right here, again, this is a great way to get an idea of what are the big priorities when it comes to implementing trailer bill, when it comes to implementing policies at DDS. So on the front page, dds.ca.gov, right here, you see a couple of highlighted areas, highlights, and then the quick links. So highlights, we have the extension of waivers and directives, and we're going to get into that in a bit. And then we also have the rate study implementation updates. As it relates to the rate study, they have put in the February 2022 rates by regional center. And so what this did was provided some updated calculations and therefore adjusted what the rates will be looking like based on the different services and service codes. And with this, they then give a percentage that shows you, let's see, I don't know how well this is showing up. Whoops, wrong way. All right. I don't know if that's large enough for you guys to see. I hope that it kind of is. But maybe since I have Carol, excuse me, Carol right in the middle of my computer screen, I'll go down to supported living. And so I think what we had heard was the rate was right around 29. And then with rate the 8%, it comes out at about 32. The original rate study amount published back in 2020 was that 32.91. Well, now they have done the math, and they've added a 13.2% increase to that to 37.24 in our area. One of the things that we've talked about is that the rate study is geographically based, and so I will tell you, if you are a regional center of the East Bay vendor and you pull up regional center of the East Bay's supported living rate, it's going to say $42 on there, because there's a multiplier that they add in there based off of geographically what we're looking at. So again, representing a 13.2% increase there. But whether it's supported living or a number of these other different service codes, we are required to break down what your vendorization is to the Burns and Associates folks. So it will help us determine how you're going to get that percentage increase. And again, that's the reason why community services staff have been reaching out to those that we need clarification on so that we can have that information. My understanding is we know that we submitted the batch two. I'm going to stop. Sorry. I'm going to stop sharing my screen. Because, and I will go back to, I'll go back to there so we can navigate to that again so you can see where you can find these things. So as far as submitting the different batches, the batch two, we've already received some revisions, a small amount of revisions. Olivia, is that the case? And which service codes are we looking at doing a few revisions on for batch two?
It was a few 055 courtesy vendorizations or user vendorizations, which I don't know if everyone remembers, but in the beginning, we were not providing any information. And then DDS and Burns and Associates decided they did want information on the courtesy vendorizations. So we needed to contact those regional centers to get that information.
So the batch two ones are in revisions right now. We had, again, submitted both of those. One of the things that DDS did this last month is send out a little report card for all the regional centers to let us know what percentage of all of our batches we're in. I expect that they will send something like that again in the next couple weeks. Batch three has a lot of transportation providers. What kind of other service codes are in there, guys? Jean or Olivia or Jordan?
Early start, some early start infant development programs, and what else?
And specialized therapeutic services.
Oh, yeah.
Yes,
that
and
was
also
huge. It was a huge.
or specialized adult residential facilities, service code 113, 115, 117 for clinical services.
They're getting more and more complicated as the batches are being released. And I think it's a real reflection of what you said and how we negotiated rates and did our cost data sheets with these vendors and had our RDAA committee years ago that looked at all these rates, and batch four is even going to be more complicated than batch three. And so I think it's kind of a reflection of the good job we did trying to individualize these rates. And then I don't know, it came back to haunt us in a way in figuring it out.
It's coming back for clarification. That's the way I like to look at it. There's regional centers, the service. You guys have heard from your peers, I'm sure, throughout the state. Every vendor is going through this. Different regional centers are trying to gather this information. The main thing is we're trying to do the best possible to be able to communicate, in essence, on your behalf how these rates are funded and what these rates that, again, are combining multiple activities, what are the components of those activities, again, so that Burns will best be able to figure out how the rate is going to be implemented. So that being said, I think I just want to give updates. Batch three will be sent in by Alta on February 28th. So those providers that have not gotten their information in, I apologize that you will not be getting your rate updated immediately, probably. We'll do our very best to get the information in as soon as we can. But as we mentioned, when we talked about it during our last vendor forum, we can't make other vendors get delayed because we don't have responses from some other folks. And so we're going to get them in. We certainly know that DDS has committed that if there are the need to do retroactive purchases related to these rates, they will retroactively do them back to the time frame they were supposed to be implemented for April 1st. But again, we would hate to get into like a next fiscal year or something like that and not have these updated for folks. So that's the batch three. And again, batch four, as Jean mentioned, we have some challenging ones. Service code 048 is in there, which is our early autism treatment programs, the EIBT programs. And I know personally, when those were in my service codes that I was responsible for as a community services specialist 11 years ago, that those rates were all over the place. And the definitions of what things meant were, it could be called the exact same thing and mean something different from service provider to service provider, all over about a 15-year period that those programs were vendored in. So we know that Nicole, one of our specialists, has a big job in front of her as it relates to that one. I think, you know, some of the other ones in batch 4, what do we have? Are the SLS ones in batch 4, or are they in primarily in batch 3?
We already did SLS.
Oh,
It was
good.
in batch 1.
Yeah. And John, our
Here we go.
EBSH
And the EBSHs is coming up.
EBCHs are in batch 4. Sorry to interrupt. Mhm.
All our behavioral services. FMS is in batch 4.
So we are looking at batch 4. We set a goal with our accounting department to get those in March 7th, which is really not very long from now. And it's going to mean a lot of work on our behalf, but I don't see how we can turn them in much later than that and have an expectation that we're going to have rates effective April 1 for folks. And again, we recognize that you're not going to be submitting your billing on those rates until more towards, you know, the beginning of May. But regardless, you know, we want to make sure that we get everything in. Where the challenge lies in all of this is, okay, so DDS made a mistake and the regional center made a mistake on our rate. There's just not a lot of time available in there. Our understanding is that DDS is going to create a path to be able to give, want a response back, an appeal to the rate per se. I don't know if that has exactly been laid out yet. I don't know that Gina or Olivia, did you guys remember hearing exactly how that's going to be laid out yet? What that is, and I know that they've said it's going to be done, but I don't know that in any public meeting they've specifically said how they're planning on looking at any revisions to those rates. Again, I would expect that if your rates come out and they look wildly different than what you would expect that they did, or you feel like there was some error made, it more than likely is going to be resolved through retroactive payment as opposed to, you know, waiting up front for some of those things. So real quickly, I do want to go back because I think I've got folks' attention in relation to the February rates by regional center. And so I'm going to go back to sharing my screen again. And as I always like to do, I want to be able to navigate folks to what we're talking about here. So I'm going to go to, again, to the front page of DDS's website. And right here on the front page is rate study implementation updates and February 2022 rates by regional center. And as an example, I will pull up regional center of the East Bays, as I said a little bit earlier. And when I go to look at their supported living amount, it is 42. Whoa, did the same thing again. 42.89. So again, remember we just showed you the one for Alta. I think it was about $3 less than that. And that's the one for regional center of the East Bay. So for all of you providers that have spent so much time being responsive back to the community services specialists, we really appreciate it. We're trying to do our very best job in getting this done. I think it's important to highlight something that we talked about during our community services managers meeting just now, and we've certainly shared it with vendors. Is there is certainly a large discussion going on about the rate study being implemented faster than what the current time frame is in with the trailer bill. And so with that, all of the groups, and many of the groups are ones that you guys participate in, are giving public testimony and are talking with DDS, talking with the legislature folks about whether or not the rate study can be implemented faster than the plan that is currently in place. We don't have any control over that. I will just say that regardless, our responsibility is to try to figure out how to do it accurately. And so however DDS or the legislature decides whatever percentages they want to give, we want to make sure that what they're multiplying it by is accurate. And that's our responsibility. And that's about all the involvement that Alta has, particularly in that. And so things change. If something, there is a movement and we're going to look at different percentages being adopted or whatever, we will certainly let folks know. But there is a lot of discussion about that in the meetings that are going on. And you will hear about it as soon as we do if there is anything that changes in relation to that. All right, I want to go back to DDS's main page and share with you what I mentioned a little bit earlier, which is that There has been an extension of the waivers and directives due to COVID-19. Again, this information is available on DDS's website. We've been aware that most of these are month-to-month extensions for a number of these different areas. And so I would encourage you all to take a look at the different extensions and waivers that DDS has put out. Some of you are aware that DDS has been codifying some of these directives into law. So it's going into statute or it's going into regulation. And so some of the directives in essence become unneeded at some point once the department has got it codified in law. Regarding, I guess one thing I will open up to, and I apologize, I didn't do it a little bit earlier since I jumped to sharing this with you guys. Regarding the rate study, there was a discussion, certainly, during the Transportation Vendor Forum related to concerns about the way that Burns & Associates and DDS is looking at figuring transportation rates. And one of the specifics is that, if everything has to be figured out at a per trip basis, then it may well work for a small regional centers catchment area. So for example, someone that maybe covers one to three counties, but when you have transportation needs throughout a large 10 county area, there's a concern about disparities being created because there is a lack of funding to cover transportation from the more rural areas and bringing them into day programs in those types of settings. And so I don't know how much more that would necessarily need to be shared about that during this meeting, but I would share with folks that there is still, I think, a large concern from our transportation providers related to that as well. And I know Eric, who's with us from UCP, was part of that work group with DDS as it related to transportation, but it did not sound like there was any movement that was made with the feedback that this was a challenge that was facing some of our transportation providers. And Jean is overseeing now directly our transportation coordinators as well as our community services specialists related to transportation. And having an area like ours, it is already very challenging to get coverage in areas that are outside of our large population centers when it relates to transportation. So I'm very cautious in how this is going because I want to ensure that we've got opportunities for all of our clients. I don't know if anyone, Eric, or if anyone else from the transportation world wants to weigh in on their thoughts about that. But again, it's something that certainly came up during our transportation vendor forum.
I think you covered it. The rate study doesn't allow for transportation providers or any other providers to apply for a supplemental rate adjustment or increase based on the location of service or the distance traveled to the service location or the miles that the client is requesting from their home to their program. And they've adjusted it by regional center in the rate study, thinking that the regional differences in rate study and average rate for all trips or something per regional center would be sufficient. I did argue against that. And I do think there is some acknowledgement that there's maybe more work to be done on the rate methodologies for transportation, but that's the big one for a regional center like Alta. Maybe not Golden Gate Regional Center or something like that, where they're all in one type of setting. But for Alta that serves 10 counties, I don't think a single per trip rate, regardless of the county or distance traveled, is sufficient. So it's something I'm hoping to change, but there's no movement yet on that.
Excellent. Again, everything flows through transportation. Like everything exists because it's all predicated on us being able to get people from one place to another. Long time ago, many lives ago, I used to work for Child Protective Services, and our world revolved around the transportation workers that worked for the county of Sacramento, because those transportation workers made sure that kids got where they needed to go and things like that. So transportation is just, I did not realize it until I became directly responsible for supervising directly the transportation coordinators, just how vital and important it is. And sitting in adult services committee over the years and hearing about the challenges of getting people to certain types of programs. Again, it is this is a tough one for us to wrap our head around, so many vendors having concerns about. And I would really hope that, we're going to be really, looking at how this is impacting the regional centers, and our ability to really provide the services that our clients require. So thank you, Eric, for that. And I would say thank you for your ongoing continued, advocacy on behalf of all of the transportation providers. I know that you mentioned that you were going to be writing a kind of a white paper again to DDS specifically related to this, and there was a call out to the transportation providers if any of them wanted to join you on that. And so appreciate your leadership on that, and specifically again, Jean and her staff are really working to get transportation services back up to where they were previously. We know we still have people coming in wanting to be new transportation providers as well. We're still getting letters of intent. We're still getting phone calls from people, but we've got to make sure that we've got sustainable rates for folks so that we can, again, serve our whole catchment area. It's so vital. All right. I want to get into a couple more things here. One of them is the Columbus Staffing Program. So we were approached by the Department of Developmental Services a couple months ago for the purposes of hosting a contract for Northern California regional centers. And it would be to be able to to be able to access emergency staffing through the Columbus program, primarily looking at individuals that are hopefully non-residential staff that might be willing to get some additional side work as residential staff, either like in an SLS setting or in a care home setting. There's lots of different rules that go into how you can participate for this program. So for example, like you can't quit your job and go be a really high paid emergency respite type worker. It doesn't work that way. Your employer has to be involved and in essence has to release you to do some of this work. So we're going to be having some further discussions about this. I've invited the chairs of our provider advisory committee to meet with myself and DDS about this next week. And we will look to actually bring DDS and the Columbus folks to this meeting, as we're going to be looking at getting some approvals from our board of directors to hold the contract in Northern California. We again are going to be coming out to all of you to explain what this program is going to look like and how we're looking at utilizing it in our area. So more to come about that. You guys remember in the beginning, many of you, we created a list of all of the day programs that had we're not doing the in-person services to see if we could have, a list of folks that could help our SLS providers. And it was not something that was terribly popular. And so I'm still very interested in looking at creative ways to solve some of the staffing problems that our service providers are having. And I'm certainly willing to be open-minded that this will work. So again, stay tuned for that. We'll give you some more information about that upcoming. I probably will look at a provider advisory committee meeting in April to have a discussion and bring DDS in. But since there's so many more people that attend this meeting and then attend our provider advisory committee meeting, we want to have an opportunity here as well to have you hear more about what DDS's idea is and how we're going to try to operationalize it at Alta. So regarding the provider advisory committee and regarding our vendor relations committee as well, and I think we might even have some vendor relations committee folks on here. Gino Nesti is going to share an idea that our regional center has in relation to community services, and maybe we'll look at working with our vendor relations committee when it comes to figuring out exactly how we're going to do it, Jean. So why don't you give folks the idea of what we're looking at?
Sure. It's pretty exciting. I think the coordination that we have with vendors and the collaboration, and I think things have really moved the past couple of years under John's directions and really collaborating and having positive relationships. And that's all coming through. I want to say about the rate studies and that your response to the questions that we're sending you and getting the information to us is really helpful. And we're coordinating with accounting and you guys and CSS, and it's really working well. for us to get that information to DDS. And with that, I think we were just brainstorming today. We always do a survey after we have our vendor orientation. And we use that information to improve our processes and the orientation itself. And it's very viable, useful information for us. And so we were talking a little bit about how we need that to be ongoing, to get input from our community and our vendors on an ongoing basis. And we're looking at, with new vendors, we're going to start with new vendorizations and doing a survey. Once they're completed with their once they complete the vendorization process, we're going to look at developing a quick and dirty survey for them to do to give us the information that we need to improve our process. And then we were talking about ongoing vendor relationships and collecting input in a more systematic manner. And so we were talking about possibly doing a survey for our vendors every 2 years when we are required to review vendor files every 2 years and update our vendor files and their licensing and all of those things that you have connected to your vendorization that are mandated. And we are looking at possibly doing a survey with ongoing vendors at a 2-year mark every 2 years. And so I think we're pretty excited. We're just in the baby stages of, in fact, we just was brought up this morning. John thought about it this morning. So I think it really excited and energized. I know it did myself and Olivia and Jordan, and I'll speak for all of us, because your input is key and necessary for us to provide quality services to our clients. And we're really dedicated to do that. And so we're looking forward to getting these surveys out. Oh, you're on mute, John.
Yeah, thank you very much, Jean. I appreciate it. We have a lot of discussions about data these days at our regional center. A lot of discussions about having data about things and looking at people's satisfaction for things. And we've certainly heard frustration from service providers over the years about their experiences going through the vendorization process. And we've heard great things from vendors about going through the vendorization process. And all the feedback matters. All that matters. All of it is important. And so I thought that, in looking at our vendorization process and what's working for people, what's not working for people, what do people like about it? What more supports do people need? I would like to rely on our provider advisory committee, vendor relations committee, to take a look at the questions that we're looking at putting out, or maybe suggest some questions of their own when it comes to the initial survey that we would look at doing for vendors upon completion of vendorization, and then the every 2-year annual survey. And we're really not talking about a lot of things here. We're talking about like maybe max 5 questions, maybe 10, maybe 5, maybe not like a whole big novel, but really giving folks an opportunity. One of the things we discussed is, giving folks the opportunity also to de-identify themselves when they fill out their surveys. We're going to have so many surveys that are going to be done. The surveys are going to be going into, a Google Excel, form in essence that gets created from the Google surveys that we do. But again, it's just giving you an opportunity to directly speak to what your experiences are, and so that we can use that information to better train our staff. I mean, being able to share with our staff all the positive things that are working and the things that we might need to look at changing a little bit to be more responsive to the changing needs of our community. If there's a vendorization process that we've got in place that was based off of the way we did things years ago, and that's not the way we do things now, or how we've moved things digitally as opposed to all of the paper forms, things like that we used to do. Again, we just want to try to constantly improve our practices. So I know we've got some provider advisory committee members on here, and our vendor relations group, I feel like, has been really good about the kind of the back and forth and ensuring that we don't grow apart as a community. I feel like that. I think that's the important part of the vendor relations, and being able to be honest with each other about things that we could do better about. And so I would hope that when we talk about this with our provider advisory committee next month that they would be on board with helping us out with a survey like this. So any thoughts about that? You know, I will say if folks want to, if folks want to send in proposed questions that we should put into our survey, because I will take that type of feedback as well. I see Lindsay raised a hand right there. I will happily have Zach put his email address in our chat right there so that if you do have ideas, so Lindsay, I will go to your raised hand, but I did want to just mention that for folks that, you know, we don't always have everyone at our PAC meetings.
I was just going to say, as the chair of the vendor relations PAC group, I think this is a great idea. I think it really ties nicely with the vendor relations subcommittee goals. So I mean, I need to speak with the group first, but I would think that we would be happy to help with this.
That's
Awesome.
great. I think it's gonna help us get to where we are current and get rid of the history. I mean, I think it's really gonna move us forward so we can acknowledge the changes that have been made, and we're not dealing with history, but we're all moving forward with the process. And I think it'll help identify where we're at, where the history was, and get off the history, get to current, and then move forward from there. So I'm looking forward to it.
Camelia might recognize a little bit of this discussion because there was a talk yesterday in a meeting that we had about sometimes it's good to get a little bit of a gut check. Sometimes it's good to see warts and all some of people's feelings about the things that we are doing. And we got some feedback related to that as it comes to our regional center developing our service access and equity policy that we're working on. And there was some real good, honest feedback from advocates and from family members and from clients about where we're at in 2022 as an agency and where we need to be. And so it's sat with me really hard over the last week or so since I've been reading it, because I think of how can we also be as responsive, you know, on the service provider end as well, to the challenges that you're facing and the ways in which we may or may not be meeting your needs, to make sure that you get through these processes and that you guys have the supports that you need. Like maybe your support needs have changed, and this would be a great opportunity, as Jean mentioned, doing it with the biennial reviews that we're supposed to do anyways just makes perfect sense, because we're going to be sending out anyways to you all to make sure the DS 1891's updated, your OIG stuff's updated, and why not also do a check-in with you all to take the temperature of how's your relationship right now with us, and what can we do better, and what's working right now, you know, what can we do more of, not always necessarily what's bad, but what do you like and what can we do more of. So anyways, that type of stuff I think will make us be very honest with each other and hopefully very responsive to each other. So look forward to that. And I will send an email out to our provider advisory committee chairs to see if we can bring this up at our next provider advisory committee meeting and get some, I guess Lindsay can talk with the rest of her group that's part of the vendor relations. So I like those meetings. I mean, I feel like honestly, this Friday meeting is our vendor relations committee every week also, because it's tough to stay mad at people when you have to see and look at them every single week, right? And talk to them constantly. Like it's, you know, you know, we put ourselves out here because we understand that you guys are going through so many crazy changes constantly. You know, the booster mandate's here. Nope, now it has been pushed off for another month. You know, this is what you're doing now, and it's going to be very different than what you're doing 2 months from now, and different than what it was 4 months from now. This is your guys' reality that you've been living in for like 2 years now. And so we just want to recognize that, honor it, and always give a place for us to have these discussions. But not everyone feels comfortable with that. And some people feel like some people need to be able to maybe send in an anonymous survey, and we need to be okay with that. Like we need to be okay that not everyone feels that comfort level, but their input is still really valuable to us. So appreciate the support from you guys. We're going to get working on that, and we're going to rely on our service providers. A set of questions created solely by us doesn't make any sense at all, right? So better to have the people that are impacted the most be, I would say, the heaviest hand when it comes to writing the actual questions. So again, we'll rely on you guys. It's not going to be a big, huge thing. We'll keep it short, but I hopefully effective. Okay. I did get very good feedback about our guest speakers that we had from the FMS, and we are going to be having some additional ones next month as well. I believe Johnny Zhang is going to be hosting our next session instead of Herman, and that's going to be related to the independent facilitators. And we've gotten feedback that they really would like someone to like have the paperwork out there and walk folks through the steps. So I think Johnny, the associate directors, the Self-Determination Advisory Committee folks are working on that, and so we'll look forward to another good training opportunity. We did hear feedback that folks liked having DDS come, having Jennifer Parsons go through the EVV stuff. For those of you that are the EVV providers, there continues to be that information that's posted on DDS's website to continue to provide you opportunities to get updated on the process for EVV. We did include the information in our last newsletter as well. So with that, that's what I have for folks for today. I will go to my community services managers and ask you guys if there's anything different. And I typically go over to case management, but I could also go to Camellia as well. But I see Jean's hand up. Yes.
I just, thanks, John. Yeah, I'm anxious to, I want to talk about AI services a little bit. And on DDS's website, and I'll share my screen, there's, oh, am I sharing the right screen?
It looks perfect. Yep.
Okay. I wanted to just draw your attention when you go to DDS's website. If you go up to their calendar, you will see a lot of trainings that are happening. And so you go to the main site, go up to the top here in the blue area to calendar, and there's a lot happening with EI. You know, we talk a lot about adult services and 3 and over and Latterman, but I want to bring to our attention our little babies in the 0 to 3 that we do serve through Early Start. And there's a lot happening within that realm also. And so there's a number of trainings happening here for EI. We're also going to do a vendor forum on March 23rd from 2 to 4 for our EI vendors. And we coordinate those vendor forums with our behavioralist, because there's a lot of not a lot, but there are some services that we need to look at for some of these children that are behavioral based services. So we coordinate those services with our EI folks. So not to forget our little ones, and hopefully they all graduate and don't become ongoing clients with the regional center, but some of them do, and that's fine too. But there's a lot of effort and time and put in for these babies so they can excel with speech therapy, occupational therapy, physical therapy, and medical treatment. So just a plug for EI and our vendor forum.
All right. Thank you, Jean. So if you could stop sharing real quickly, I just have one last quick note here.
Yeah, let me.
Oh, I see Garrett raised a hand. Go ahead, Garrett.
Yeah, one of the things that we talked about briefly in a previous pack was potentially a training or a reference sheet for health and safety waivers. Is that still on the horizon?
It is, absolutely. We're looking at a one-pager for the health and safety waivers. I think I already have a draft of that, don't I, Jordan? From Dan?
You do. So we can pick a date for that, and can we announce that next week at coffee? What date it'll be?
Well, I think the date will be that we will release it at our provider advisory committee meeting, and then we'll set a subsequent coffee with community services where we can just specifically highlight the health and safety waivers and everything else. And we can announce that we have made an offer. We have someone in the background check process to actually specialize in providing health and safety waivers. And Jean, let me see if I can get you to stop sharing your screen real quick.
I am trying. I just lost my knowledge of how to navigate this.
If you go up to the very top of the screen, you can share it. Should be able to close it out.
Oh, dang.
Or not. All right. Well, then in that case, one thing I did want to follow up with all of you about is, in the Sacramento region, you've got a lot of individuals from the Ukraine. And so, and in our field, you have a lot of Russian speaking providers, and we've got a lot of individuals from the Ukraine. I personally have supervised staff from the Ukraine as well, who's born there, his family is currently there. I would just check in with your workers, check in with your people. This is extremely challenging time for all of them and their families. And so I would just as a reminder for folks to check in with your folks. So that's all that I've got for today. And we'll look forward to talking to folks again next week. And folks have a great weekend. And it'll stop sharing as soon as I end the meeting, Gene. Watch.
Oh my gosh, I don't know what I